We now present Dr. Michael Golding. He is the Chief Psychiatrist of the California prison system. He and his team are responsible for the mental health of approximately 100,000 incarcerated people. Today he will talk about the dangerous culture of incarceration as well as physical and mental health in prison. Welcome, Dr. Golding.
Hi, everybody. First of all, I want to big shout out and thanks to the Humanist Association for allowing us to speak here today. I also want to thank the previous speaker, Ms. Nadia, who I very much appreciated what she said. And I wanted to just give, this was not part of the planned thing, but I really want to give just a 10-second shout out to Smart Recovery. If you haven't heard of it, it's the Alcoholics Anonymous replacement for the non-religious. So can you please, if the person's religious, get them involved with AA. If they're not religious, get them involved with this. It works. It's very effective and it's excellent. If someone wants to ask more questions about this later, I've been a big advocate of Smart Recovery for a long time. Thank you. By the way, I have been involved, a leader in correctional psychiatry for a long time. I'm speaking to you, however, as a private citizen. And there's a lot that all of us can do as private citizens. And I want to go over just some of the basics of the physical and mental health in prison and our culture of incarceration. And there are 4 basic things I'm hoping that everybody's going to get out of this. Okay, the 4 things that we're going to talk today about, and we're going to do this very quickly at lightning speed, but we're going to give you an overview. The goal is to give you an overview. First is the US has an incredibly high rate of incarceration relative to the rest of the world, okay? Because of that high rate of incarceration, and believe me, it's going to be stunning to you how high it is. Just hang on for a minute. That has adverse consequences for our physical and mental health. Prison isn't good for you, okay? Lots of people in prison. Prison isn't good for you. 3, mentally ill are not given leniency. Even the things that many of us think of as good things, like diversion courts, those don't necessarily work. In fact, often they don't. In fact, often they do the opposite. So it's not enough to have a good idea. You got to follow through. We'll talk about that briefly. And the other thing is that there are moral consequences of a punitive system. And, you know, we're going to explore that with a bit of a difference between someone with, like, we're going to talk about a biologically mentally ill person versus someone who may have been more willful in doing something. And regardless of one's views about where one draws the line in that scenario, clearly when people have no idea what they're doing, it's hard to make an argument for putting them in prison. I want to show you this slide. Anybody gasping? We're the highest in the world. By the way, I'm not saying it's the worst in the world, like North Korea. You know, I'm not sure. We're not shooting people, killing people in our prisons as political prisoners. I'm not claiming that. I'm just saying that there's an enormous amount of people who were incarcerating, far more than Russia, Cuba, China, any of them, as a percentage of the population. And the point I'm going to make here also is that when something has a beginning, it can go back to that beginning. We used to not be that way, and I want to show you that in a minute. Currently, we're about 700 or 800 per 100,000. We used to be about the same as Finland. That was just in the 1950s. So the 1950s, we weren't incarcerating everybody. Now we are. It's a long topic as to why that is, but I'm going to give you a very quick summary of why, and we can discuss more of the details later. But why have we gone from 160, 170, 180 to 700? 1, the war on drugs. 2, many of these 3 strike laws. You know, you get life imprisonment for a third felony. The other one is mandatory minimum sentencing. And the other one, which I have particular knowledge of and particularly annoys me, is deinstitutionalization of the mentally ill and using our prisons as the new state psychiatric facility. Okay, this is just a map of the world, and you can see over here in red There are many, many things in this country to be proud of. Many, many wonderful things that we've done. Being our prison system is about the least proud thing we should. I mean, we're utterly disastrous relative to the rest of the world. And by the way, that doesn't mean that we have less crime because we're putting people in prison. Quite the opposite. We have more crime on average than most Western industrialized countries. But Australia, look at increase in incarceration rate. This is Finland, by the way, where we talked about before, which is about the, 70 to 80 or so out of 100,000. This is 1980, and this is 2000. Wow. Our incarceration rate just skyrocketed. This, again, for those 4 factors that I talked with you about. And no doubt there are others. Okay, I would like to have you focus just on this one box right here, okay? Just this one box. That says children born 1990, the risk of paternal imprisonment. So that means if you're born sometime between like 0 and age 18 or 20, a parent is going to be in prison. Looking just right here, this is the total population. This is the white population. This is the African American population. About 20%. But let's say you're a high school dropout. Again, 5-10%. 50%. Think about that for a second. What is it going to be like for an African American kid to grow up and they have a 50% chance of their father being in prison? What's that going to do to you? Well, if you can think about it in 2 different ways, and I think your imagination is probably accurate. One can think about it in 2 ways. One, well, it makes you very mad at the carceral system, really, really mad at it. The second, if you feel your father did something wrong, then maybe you're kind of mad at your dad. One way or the other, if you're growing up as a kid, you don't have a role model in the home, especially if you're a male child. And what is that going to do to the next generation? Here are just some rough numbers. I just want to show you something. This is a tough curve, but I'll go through it very quickly and we'll get it. This is the prison rate in California. This is the mental hospital rate, and blue plus red equals orange, okay? So this is the total this is mentally ill plus in prison. Okay, so let's just look at the prison rate. Going fine. So here we're like 1950s or so. Remember, we're kind of like Finland here. We're running around 170 or so. Uh-oh, something happened here, and we're going nuts. Now I want to show you what happened to the mental hospitalization rate. There we go, up like this, like this. Bang, we closed our mental hospitals, and what did we do? We put them in prison. So this goes along with the other well-meaning people. Well-meaning people closed our mental institutions, I think, in general. People are not trying to destroy things, not trying to be evil. But then they said, we're going to care for them in the community. Did we? No, we didn't. We didn't develop a community-based care. Instead, our citizens were much more willing to fund what? Prisons. So instead of calling them mentally ill, we called them criminals, and we put them in prison. The overall goal of this talk is I'm going to demonstrate as quickly as I can that prison is bad for your health. But there's one canard that people say that I want to briefly address so that you know how to respond to it. Okay, and that canard goes like this. And you sometimes hear it by groups of people who aren't as sympathetic to this cause. And so I just want to say it, and it goes like this. Dr. Golding, that's all well and good and all, but are you aware that the African American males actually live longer and do better in prison? And actually, there's a tenth of a note of truth to this, which is that if you look at a young African American population as a prevalence in jail or prison, they actually have lower mortality for the time that they are in prison. Now, why is that? It might be drug and gang violence, and it might be that they have some access to medical care in prison, which they otherwise wouldn't in a horrible, horrible society not caring for them well. So that's one factor, but something else to consider. And without going to the details of the epidemiology of this, I want to teach you how to answer this question. Someone says that to you, this is the response, and it's a well understood response. You have a lifetime. You spend 6 times more time out of prison than in prison. Okay, people are spending 6 times more of their life outside of prison than in prison. If you're not learning how to be better, then your death rate outside of prison, so the overall death rate, in fact, goes up if you have any history of being in prison. So even though for a short period of time, it can be safer in prison for people, over the long term, it absolutely is not. And without going into too many of the details, people have tried to control for this. And the basic idea is that you're not learning the skills you need in prison to be able to function outside of prison, even if you temporarily have a little bit better care than you might in the community, which is a deep indictment of our community also, isn't it? If you get better mental and physical health care in our prison than you do in our community, what does that say about the community? Overall, if you look at it over time, though, for everyone, prison is bad for your health. Okay. Just pause for a moment. Just look at that. This thing is called melancholic. I see it as sort of a depressed person looking longingly for death. Now, I'm not an art historian. Those of you who are, please give a better and fuller description of this. There are many reasons why the medical and physical health is worse in prison. One of the reasons I want to focus on is stress. Certainly higher rates of STDs in prison, higher rates of hypertension, diabetes, and asthma. There are also higher rates of all kinds of cardiovascular disease. And the reason for that is that prison is a highly stressful environment, and stress is simply bad for your health. Without going into too many of the details, even things like cardiovascular disease, your blood vessels constrict and dilate more under stress. And what that does is there's this delicate lining of the walls called the endothelium of the wall. It damages it. And when it damages it, the parts of the blood that cause clotting actually can then get into those little damaged areas, and they start clogging your coronary arteries. Without going into the detail of this, is an extremely interesting phenomena, was that if you cut what's called the stellate ganglion, which is a fight or flight ganglion, the part of your nervous system that makes the fight or flight thing, in a newborn pig, you'll get a very, very fat, immobile pig. But no matter how big that pig is, that pig will not develop coronary artery disease. So you need stress. It's not the full explanation, but stress, you must have stress as a precipitant to develop coronary artery disease, which is an interesting thing. This is a very, very angry guy, a beautiful picture from Netter and stress. And anyone who's interested in the physiology, this is what I did my research on. I love this topic. I could talk on this all day, but this is not what this conference is about. Nonetheless, stress is really bad for you. It destroys everything. You can't make a distinction between medical and physical illness in this sense. Stress is a mediator of both of them. And if you don't get stress down, things are going to be bad. We got to teach people to relax. We got to teach people to enjoy things. No wonder you're not learning anything good in prison and you're dying later. If you're not learning how to live in life, prison is going to be very bad for your health. And I just want to show you some very, very quick data on this. This is a very famous study by a woman by the name of Fraser Smith in JAMA. And what she did is basically followed people who had had a heart attack for 6 months. She initially rated them as depressed or not depressed. And depending upon how you look at this study, it's about 3 to 5 times the rate of death. This has been repeated many times. I quote her because she was the original person who did this. But about 3 to 5 times the increased risk of death in those who are depressed. Now you say, well, no, maybe those who were depressed had worse coronary artery disease to begin with. No, that's not true. They had less coronary artery disease to begin with. Simply that depression is a deadly risk factor. as deadly risk factor as diabetes or high blood pressure or anything else, and it should be considered that way. Depression kills people. In our prisons, schizophrenia, other psychotic disorders, and major mood disorders, very high rate. It is said that 50% of the prison population has a mental illness, and about 20% of the standard population. It's higher than 50%, because if you look at rates of substance use disorders and such in prison, it's more like 90, 100%. It's just not true. But that I'm giving you the standard line. My view is that it is much higher than that. The other thing is, I'm just going to show you one of these courts. Remember I told you the four things? We're going to look at whether they're really, that we're incarcerating a whole lot of people. We're saying that that has bad health consequences, and the mentally ill are not given any kind of grace, if you will. This is just an example of a court looking at the mentally ill as a separate population. This is a diversion court. Without going into too many of the details of the graph, the diversion court seems to be punishing them more than the non-diversion court. So we all have wonderful ideas, okay? We want to get people out of the institutions, but if we don't build community hospitals, that's going to be a bad idea. We're going to all be excited about having diversionary things, but if we don't give, and by the way, I'm not blaming the judge, if we don't give the judge an alternative, maybe the judge puts them more frequently in prison. So having good ideas is not enough. Following through on ideas is really what we need. And this is just another way of looking at it, that the mentally ill are every bit as likely to serve out their prison terms as the non-mentally ill, and if anything, it's worse. So we're not giving grace to our mentally ill people. Now, and I just want people to consider this. Schizophrenia is a horrible, horrible mental illness. It's biologically based mental illness. The best way I can describe it to you is think about when you were dreaming last night, or think about when you had a nightmare last night. Now, occasionally we have an awareness that that nightmare isn't real when we're dreaming. But do we always, or even usually? No, we think it's real. You think it's absolutely real. So you have this sense of doing all kinds of weird things in a disorganized way in your dream. Now imagine if that were sort of day-to-day life. That's what psychosis is like. So you may think that someone's trying to kill you in your dream and you're running for your life, but they're not. So schizophrenia, often they don't know what they're doing. And so let's say you have a 44-year-old patient with schizophrenia who is found in a neighbor's home, claims the house and its property is his, and he assaults a police officer when confronted. And a personality disorder is more like, there's more conscious and understanding of it. I'm not going to claim that a person has full free will or some sense, but there's certainly a difference. If you're found in a neighbor's home and you're taking property and you're saying, well, I hate this guy because he hasn't been nice to my dog, there's a difference. There's a difference between someone who has absolutely no idea what is going on and someone who's doing that more willfully. Maybe neither of the men should be in prison. Maybe both should be in diversion programs, but if anything, they should be in different diversionary sorts of programs. And so the discussion that I want to bring up in those two cases, is it right to convict? Should it change the type of sentence with someone with schizophrenia versus someone with more of a personality disorder who really understands that he's hurting somebody else, or at least in some sense does? And how can sentencing send a deterrent message to someone who's in a dream? If you were punished for the contents of your dream and acting on that, how would that go? I mean, it just doesn't make any sense. If our prisons are full of people who lack capacity, how does that affect the deterrent effect of carcerations? You know, I pointed out below that we have higher crime rates and higher rates of incarceration, and we used to not relative to other people. Something that has a beginning, i.e. increasing the rate of incarceration, can have an end. We don't have to do this forever. You're going to see models today of countries that don't do this. Much better way of doing our system. We do incarceration very, very poorly in this country. Is any given punishment worse for the mentally ill? Does prison worsen mental illness? The answer is yes, it does, without going into too many of the details of that. And so we started with the idea that there are four basic points. We said that the mentally ill end up in prison at very high rates. We said that has mental and health, physical consequences. We said that our prisons tend not to treat the mentally ill any better. We don't give people grace. And we said that that has significant consequences, moral consequences for our understanding of ourselves and what we should be doing to help our fellow citizens. With that, I'll turn it open to questions.
There is one question that Nadia has in the chat. Did the closing of mental hospitals coincide with the increase in for-profit prisons?
Yes, that we built state prisons and for-profit prisons when we were closing the mental hospitals. There was money involved in incarceration. The prison industrial complex made a lot of money. People, taxpayers, are much more willing to fund, unfortunately, incarceration than they are treatment of the mentally ill. And so we transferred people to a far more expensive environment to treat them than the state hospital, however expensive that was, and however bad that may have been. And there are many cases of disaster there. However bad it was, it's not as bad as our current prison system. Please, next question.
Even though I am of the age that I should know this, I don't know the year the mental prisons closed. I remember once volunteering in one. I believe there's still some mental prisons. So, I mean, excuse me, I'm using the wrong word, mental hospitals. So when was that a federal rule? And I know there are mental hospitals and some incarcerated people, juveniles, do go into them. So to what extent did they close? Where I work, there's a number of homeless people who are obviously mentally, they're talking out loud, mentally disturbed. And the city of Dallas, Texas, where I live, tolerates it. But I imagine that they do have the option to get some medication. But of course, you may not know the answer to that. So I guess the question's like, when did they close? How did that affect the state? Still could have, was that a federal ruling? And could the state still have mental hospitals, but now it's limited?
No, we still have mental hospitals. Let's be very clear on that. Nobody passed a federal rule about no state hospital. We have, for example, in California, the Department of State Hospitals. The issue, and it's a good question, the issue is that many, if I will, good-hearted people, many civil libertarians, for example, like myself, and I wasn't alive back then, but I can see myself have gotten involved in that movement to take people out of the prisons. I'm just saying that I would have been one of those guys. It's just that in hindsight, if you're going to come up with a reform, please follow through. You have to then support the community. If you're not going to do that, then don't take them out of a slightly better environment. And so in the 70s, there was massive decrease. And so the population, as I showed you, was shifted. We have it's way more than 80% of capacity. Let's just say that as a nice round number. More than 80% of our capacity in the state hospitals, I'd be surprised if it was not far more than that, have been shut down because of our lock 'em up philosophy, lock up the mentally ill philosophy, which is just, by the way, I assume that the majority of people here are progressives, but by the way, you can appeal to individuals across the aisle on this. It's more expensive, guys and gals. You can speak to our Republican friends and we can tell them that it's more expensive and we can show them studies that it is. Don't do that. I mean, can we all agree on saving money if we can't agree on saving people?
Sorry, I'm a little nervous, but
as
you
great,
stated, mental state hospitals, there is some, but as we know, the beds are scarce and our loved ones stay in jail for a long time and they just get fragile and, they deteriorate. So what is being done for more beds to be open and for quicker care for them?
Yeah,
I see it, like I stated, my son has schizophrenia, and this is something new to me that I was able to get a better understanding. I'm still learning, you know, and it's been a journey for me to even have contact with him, and I still don't have contact with him because he's deteriorated. Yeah, so with that question, what's being done with the beds being open at the state hospitals?
I mean, there is nothing being done. What's being done is that the beds more and more are being closed. Nothing good being done. We are there, which is not to say that there are not good people like yourselves who are fighting. And so in a sense, in terms of the outcome, we're slightly losing. In terms of the interest, we're slightly winning. So I think I sense a groundswell of interest, and a conference like this is very important. But absolutely, you know, I personally find when I'm making these arguments, I want to appeal to people's morality and ethics and sense of humanism. But sometimes just showing them dollars and cents figures convinces people. I mean, how foolish do you have to be to waste money on incarcerating the mentally ill? People with schizophrenia, by the way, far, far better outcomes in our state, on our national state hospital systems than in prison.
Well, thank you, Michael. Wonderful job.
Thank you, everyone. Take care.
Thank you so much, Dr. Golding. And I mean, that was such a powerful presentation, so much great information you presented. I know that this conference is just the beginning of a number of conferences that I know Nadia and her team at American Humanist Association are going to want to continue. And I'm sure we're going to want to have you back and continue this important discussion on the role of mental health in the prison system.
Thank you.
And you know, right here in Orange County, I was just at a day-long conference on healthcare in Orange County. The topic of mental health was one of the big topics. And so it does seem that this is becoming a topic of more and more discussion. And hopefully we're going to start seeing some solutions that can help with this issue as well for the incarcerated. So thank you again so much.